Welcome everyone to another wonderful episode here at Jaws Podiatry. Case update. This is a beautiful transformation. Young patient came in with bilateral bunions, unsightly, and it's been 4 days since the surgery. Let's take a look. Everything looks, when you talk about, how great things look, everything looks beautiful. Minimal swelling, minimal bruising. And I was just telling mom and the patient that, the foot really never lies. The minute that I see feet like these, I know that the patient is being extremely compliant. We were just talking with mom and the patient that, right now we do have a little bit of a space between the first and the second toe, and eventually that's gonna close. Right now we're just overcorrecting a little bit the great toes, and they'll be like that for a couple of several weeks, and then eventually we're looking for a very natural. Some people like their toes just like that, like really straight. But some people like them a little bit more natural. So eventually, that's the nice thing about these techniques, that we're able to kind of manage the progress and kind of place the toe wherever the patient would like to see it, where they would like to see it. But we have one tiny little stitch right here and one here. That's it. But Dr. Wagner, I don't get it. Where are there any screws, pins, anything? No. That's where we use our splinting techniques. Look at the left, same thing. Little stitch, little stitch. This is all swelling, by the way. There is no bump there, I promise everyone. This is just puffiness. And once, in a couple of months, all of a sudden that swelling is just gonna, disappear completely. There is nothing there. Beautiful. They're smiling, I don't know, at me or laughing with me or at me. It just doesn't matter, right? It really doesn't. We were also talking about the patient, 4 days, and the patient was kind of surprised with the level of pain.
I thought it would hurt more.
So the patient thought it would hurt more, and then on a scale of 1 to 10, 10 being the worst,
2.
A 2. So, these are, I don't want to say it's a perk, but, using these minimally invasive techniques, that's one of many. There's, less dissection, less pain. It's a better recovery as well. Patient's walking. Some people kind of like scratch their heads and say, but how? Patient is walking.